Today I'm going to demonstrate how to give IM and sub-Q and oral medications to infant. I washed my hands, I gathered my supplies, I've already checked the expiration date on my syringes, and I put on my gloves. So the biggest thing with giving injections is that we need to make sure we're giving them in the right site, right place, pretty much the 6 rights of medication administration. Typically, mom will be holding the child. In this case, that's not needed because it's just a demonstration. So for the first one, we have to check our physician's order. So my infant here, first you verify the patient, check the name and birthday. So we'll say she has a little wristband. We'll call her Ava. Ava Besselou, 11/19/18. Checking the order, Ava Besselou, 11/19/18. Good. So with the flu, the first one is the flu vaccination. It's going to be given IM. We're going to use a 1-inch needle, and the dose is for 0.25 milliliters. So you take your alcohol, you're going to clean the vial, the rubber stopper in the vial. You can set that down. So we said 1-inch needle for IM injections. This is a 1-inch needle. And this, I'm going to go ahead and pull the baby's pants leg up. Okay. Now this is plastic, so the needle's not going to go in. So what you do for 0.25 mLs, you go ahead and pull back. Actually, we should have a TB syringe, or not, because they only go up to. Okay, 0.25 mLs. I'll pretend. Pull the cap straight off, you set that down. Now you inject, can you see? To your medication vial. You push that in and you invert. And you pull back. Okay. And you recap your needle using that one-hand method. Awesome. So then use another alcohol swab. I'm going to clean the site. For IM injection, you let that dry for 60 minutes. 60 seconds. For IM injection, you're going to dart-like motion and 90-degree angle in that site. Like I said, the needle won't go in there, but I will demonstrate. After it dries, you pinch the muscle up. 1, 2, 3. Then you would bring the needle straight up and activate the safety. It's a vantage point, so you push it in and it takes up the needle. Okay. So she had IM flu in that thigh. So there is cute little band-aids we have for them. It probably will help if you open your band-aids before you put on the gloves, but I didn't, so we'll have to improvise. And of course the baby is squirming and crying, but this is a good baby. She feels no pain. And their band-aids are smaller for pediatrics. I'm gonna pull that pants leg down. except I can't, so we'll just leave them for right now. Okay. And now we're going to do our next order. She's going to get the MMR vaccination sub-Q. Once again, she's an infant, so we're going to use a 5/8 inch needle. And the dosage for MMR for infant is 0.5 ml sub-Q. So same thing. You pull back. This one's already pulled back to 0.5. We'll pretend like this is the MMR vaccination. Clean the stopper. Circular motion. And we're going to use her right thigh for this one. Let's see. I'm going to try to open the Band-Aids first this time. Okay. All right. Let's go ahead. I should have kept that one, but I didn't. Put that down here. So uncap your needle. Next one, you do the same thing. Your medication vial is there. There we go. Inject the air straight in. Invert. Pull back to 0.5. You recap. So make sure there's no air in there. And doses 0.5. Okay, this one's gonna go in her right thigh. Clean. Uncap. This is a plastic doll, so unfortunately I'm not going to be able to inject, but I can hold. You inject 45-degree angle. That wasn't 45 degrees. I am 45 degrees. Oh, it did go in. You stabilize your needle. Why don't you start giving? I can't give it though. Okay, pull it out. I was able to give that and activate the safety. And the Band-Aids. My patient is very tiny. So like I said, the Band-Aids would be a lot smaller. Okay. Now baby girl still has to get Tylenol. Well, pretend she weighs 19.7 pounds. So with the oral medications, this is my daughter's actual Tylenol. And we're going to drop 3.75 mLs per the chart here because she is 19.7 pounds. So usually there'll be a stopper in here, but I don't have the one with the stopper, so typically I would invert it, but I can't do that without making a mess here. So I'm going to draw it up. And the dose is 3.75 mLs. And we would give it to her in her mouth. So you would, this is a lot for her. You would give it in small increments, like just kind of like push pause, giving her a chance to swallow until the dosage is empty. But I'm gonna put this back because this is my daughter's expensive Tylenol. And Miss Ava here also, let's pretend she's a little bit bigger. And now mom and dad come to the clinic and we want her to get varicella. So now she's a toddler. And for varicella, she can have, it's a sub-Q injection. So we're gonna do a 5/8 inch needle. And it's going to be done sub-Q. And now that she's taller, we can actually do it in the deltoid. Since we already have both shots there, we'll pretend like she's a big girl now. And then we'll use her deltoid. And, you know, when they come to the office, they'll be undressed. So I should have just demonstrated them the baby being undressed here. Okay, that'll work. So, different visits. She's a toddler now. I'll come in, gather my supplies, wash my hands, verify my patient, check the physician's orders. And today she has ordered the varicella sub-Q for her toddler. You check the administration record and it says that she's to get 0.5 ml sub-Q. It actually says sub-Q. Yep, sub-Q. All right, so 5/8 inch needle we said. Here. Put my patient to the side here. Pull back. 0.5 for the air. Inject the air into the vial. Wait, we have to clean the rubber stopper. Mentally, it's not the same rubber stopper. We're going to say it's a new one. Then we can use that. Put the cap on. Till now the 0.5. 1, 2, 3. Push the air in, invert. There is a bubble in there. Put it back down. And that quickly, it's gone. So you recap your needle with the one hand method. Perfect. Use quite a bit of alcohol. Clean the baby's deltoid, the toddler's deltoid. Ava would not be sitting down this still. So for here, you would first find the placement of the deltoid of the toddler. Her arm does not extend, obviously, like ours does. But it'll be 2 finger breaths down from here, which it would be here. So the child would not be this still, And since it's sub-Q, take your cap off. I don't know if I'll be able to puncture her in this arm, but we'll try. Actually, I'm kind of scared to puncture this plastic. 1, 2, 3. Yeah, I'm not going to try to puncture this plastic. Or maybe I am. There we go. Once the needle's in, you come up and stabilize it. And pull it out. Activate your safety, which this one is this way. Okay, and the safety is activated. Let's go back. So there has been an error on this nurse's behalf, so I would identify that I just gave varicella sub-Q in the deltoid. So of course I would notify management, follow facilities protocol, and see what I'm supposed to do for there, but that was not supposed to be given in the deltoid. I should have given it in the sub-Q area, so I could have used another area. I could have used the back of the arm. I should not have given that IM. So I have one more needle, I believe, that I can re-demonstrate that with. And we can play pretend. I don't have another needle. Okay, so I'm verbalizing that I made an error. The varicella was not supposed to go IM. It was supposed to be sub-Q on the toddler. And now I gather up all my supplies, put the sharps in the sharps container, and clean up my area. I will provide the parents with information in regards to the immunization and vaccines that child's received today. The most common thing, that child may develop a fever. Depending on the age, she can go ahead and administer Tylenol for the fever, and that is common. And just a schedule on when the child's next vaccinations are due. And that completes the video.